Hey guys, welcome back to Med School Moose. This video is going to be USMLE Step 1 High Yield Concepts about Bacterial Endocarditis. So before we get started, a few quick disclaimers. I know the title says USMLE Step 1, but this information is definitely high yield for both the USMLE and COMLEX Level 1. The information may vary slightly. The information is just from the resources that I found and that I used. You may be using resources that say different things in terms of pathology and treatments. I would recommend just going with your resources, even if it's a little bit different. And for these videos, there's going to be high yield text and high yield audio. And the reason for that is I know there's different types of learners out there. Some people are visual learners, some people are auditory learners. So I want to make sure that there's high yield information in both formats to make sure that all types of people are engaged and you're maximizing your studying. So I think this is the first high yield concepts video that I've done in a while, and I'm pretty sure it's the first high yield concepts video that I've done about a specific disease process. So moving forward, when I make high yield concepts videos about diseases, I'm going to kind of break it down in this outline. We're going to define the condition. We're going to talk about the causes, the risk factors for getting that disease, signs and symptoms, diagnosis, and treatment. So I'm going to try and break it down. Like I said, pretty much all of this information is high yield. I will bold things that are in yellow that are like very, very high yield, very likely to be tested. So with that being said, let's go ahead and get started with the definition. Really, the definition is in the term itself, bacterial endocarditis. It's a bacterial infection and inflammation of the endocardium, endocarditis. And the really important thing about bacterial endocarditis is that it commonly affects the heart valves. As you can see here, the bacteria can seed on those heart valves and damage them and cause a lot of bad problems. And of course, if it's going through the heart, it's going to circulate through the body, and it can cause a lot of problems elsewhere as well. In terms of the causes of bacterial endocarditis, there's many. The most common being Staphylococcus aureus. Some other causes are Viridin streptococci, Staphylococcus epidermidis. The high yield thing to know about this is that it commonly affects prosthetic valves. So if you see a patient on the exam, they have a prosthetic valve, they have a fever, they have some of the other findings we're going to talk about, you want to be thinking about bacterial endocarditis and you want to be thinking about Staphylococcus epidermidis. Another cause is Streptococcus bovis, previously Streptococcus galolyticus. The high yield thing about this is colon cancer. A question that I've seen frequently, they're talking about endocarditis, they give you the diagnosis, and then they say Streptococcus bovis. They give you all of that, and then they ask you what is the thing that this patient is going to need in follow-up, and it's going to be a colonoscopy because they are very high risk for cancer. Some other less common causes of bacterial endocarditis include Coxiella burnetii, I think I'm saying that right, and Bartonella. There are other causes of endocarditis in general. There's Candida, there's Aspergillus. I guess you could kind of group that all under infectious endocarditis, but we're not going to talk really about that in this video. And other causes of endocarditis such as malignancy, hypercoagulability, lupus, not as testable, but still important to know. So in terms of the risk factors for bacterial endocarditis, the big one, the very testable one is IV drug use. Anyone who's an IV drug user who has a fever, new heart murmur, those kinds of things, you absolutely need to be thinking about bacterial endocarditis. Like I said on the last slide, prosthetic valves, as you can see here, very high risk for bacterial endocarditis. Anyone who's had a recent dental procedure, anyone who's had a recent surgery, and anyone who has infection anywhere else in the body, it can get into the blood, it can circulate to the heart, seed on those valves, and it can cause bacterial endocarditis. So those are the risk factors. In terms of the signs and symptoms, I'm going to kind of break this up into three different categories. There's going to be the constitutional symptoms, which are kind of like the general, non-specific things. There's going to be cardiac symptoms, and there's going to be non-cardiac symptoms. This is a great graphic from Osmosis. It kind of breaks down all of the symptoms. It's this mnemonic from Jane. I'm pretty sure they're still using this in the first aid book. I don't really like this mnemonic. It's pretty long. You have to memorize like 8 things. But for those that like mnemonics and are visual learners, I put it there for you guys. So let's go ahead and get a little bit more into the details. First is going to be the constitutional symptoms, and I love this GIF, so I just wanted to have an excuse to use it. But it's going to be all the common things, right? It's going to be fever, malaise, weight loss, night sweats, arthralgias, the patient's just not feeling well. They may also have cough, shortness of breath, pleuritic chest pain. you're going to see that on a ton of different questions. That's probably not going to really lead you in any direction. But one of the big things is going to be the cardiac symptoms. I already alluded to it earlier on a previous slide, but new heart murmur is going to be a big one. All right, IV drug user, fever, new heart murmur, that is just screaming bacterial endocarditis. Some important other high yield things to know about this: the mitral valve is the most frequently involved, and the tricuspid valve, tricuspid regurgitation, is most common in IV drug users. And I was trying to find information about that. It is the first valve that blood enters in the heart, so that might be the reason why. But let's say it again: IV drug user, fever, new heart murmur. That new heart murmur is most likely to be tricuspid regurgitation. In addition to that, you can have heart failure, and that'll be due to eventual valvular damage from the bacteria damaging the heart valves. And you're going to have arrhythmias, and those arrhythmias can be due to perivalvular abscesses and conduction abnormalities. So as you can kind of see here, the infection gets so bad, it's damaging the valve, it's causing an abscess, it can affect the electrical conduction of the heart, and that can cause arrhythmias. In terms of the non-cardiac symptoms, this is extremely high yield. You will get questions on this. I'm going to repeat that. You will get questions on this. Everything on this slide is yellow. You absolutely need to know this because this is easy points to get and easy points to lose. So we're going to go through a couple of these: Roth spots, Osler nodes, Janeway lesions, septic emboli, splinter hemorrhages, glomerulonephritis, and anemia. I know it's a lot. You just got to review it. The mnemonic is there if you want to, but let's go through a couple of these. The first one is going to be Roth spots, which is these round retinal hemorrhages with pale centers. This is a very good example of one here. So in that vignette with the fever, the IV drug user, the new heart murmur, they may give you something like this, and they're going to be alluding to Roth spots, and they're going to be alluding to bacterial endocarditis. Another really common one is Osler nodes. These are painful, tender nodules on the pads of the fingers and toes. As you can see, a raised nodule right here. And this is caused by immune complex deposition. And how are you going to remember that Osler nodes are painful? You know what else starts with O? Ow. So Osler nodes, ow. That's the very common association. And that's going to help you differentiate it from Janeway lesions, which are painless, non-tender, erythematous macular lesions on the palms and soles. So both Osler nodes and Janeway lesions can present on the palms and soles. As you can see here, they look a little bit different. Osler nodes, painful, Janeway lesions, painless. These Janeway lesions in particular are caused by septic microemboli, so the bacteria is just kind of getting seeded throughout the body, and it gets into the capillaries, causes damage, and you get these small little erythematous macules. One of the other important ones to know is splinter hemorrhages. I feel like most people know this one pretty well. You can see it very obviously here. It's tiny hemorrhages underneath the fingernails that they may certainly show you a picture of. So those are the big ones. In terms of the diagnosis, I don't know if they would necessarily test this, but you're going to get 3 sets of blood cultures for anyone that's been in the hospital, worked. If we're concerned about an infection, we typically just get 2. For bacterial endocarditis in particular, we're going to get 3. And I tried to find the information on this. I think it's that 3 sets of cultures increases the sensitivity because this is something that can make people very sick and we don't want to miss it, but couldn't really find clear information about that. In terms of the other things for diagnosis, we're going to want to do a TTE, a transthoracic echocardiography. As you can see here, this is a great picture of one, and it's also showing a mitral valve vegetation, so the bacteria is damaging that valve there. Another important thing to know is that TEE, transesophageal echo, is more sensitive than TTE, but it is also more invasive. And then the last thing for tissue sampling, the last thing for diagnosis is going to be tissue sampling here. And that's going to be histopathology of resected valves after surgery. So someone has bacterial endocarditis, they have valvular damage, they're going to go get a new heart valve or a prosthetic heart valve, and you're going to do histopathology, tissue sampling of the damaged heart valve to see what was causing it. The other important thing that I want to note, going back to blood cultures real quick, is that negative blood cultures, even all 3 negative blood cultures, do not necessarily rule out bacterial endocarditis. So that's just an important thing to know as well. In terms of the treatment, these patients are at very high risk of getting sick, especially those people like IV drug users who don't frequently access care, who don't take care of themselves. high risk of getting sick, so they're going to need to come into the hospital. They're going to need IV antibiotics. This is typically caused by some pretty nasty organisms, so an infectious disease consult is absolutely warranted. Patients may need IV antibiotics for up to 6 weeks. Obviously, one of the big bugs that we talk about nowadays is MRSA, so you're going to want to consider vancomycin to cover for MRSA, especially in those IV drug users. And sometimes if it's really bad and these patients have, valvular damage, conduction abnormalities, they may need a surgery consult for valve replacement. So I think that is the end of this video. Hopefully I didn't go too fast. Thank you so much for watching. As always, please subscribe to my channel, like and comment on my videos. If you have suggestions on what I can do better or videos that you want to see in the future, please do let me know. I hope that this was helpful. Thank you so much for watching and good luck studying.